Now, meanwhile, in India, with a rising number of cases, it's important to stay aware of the facts. The government has now issued an advisory on who needs to be quarantined and for how long. So let's get you the details in terms of what the government intends to do at this point of time. So the first question, of course, is who should be quarantined at home? And this is what the government has said, that any person who's been in contact with a suspect or a confirmed case. Now, the second question is, how long should the quarantine period last? Now, it's being said that the home quarantine period should be no less than 14 days from the time of contact with a confirmed person or earlier in the case of a suspect. Now, also the question, of course, is what will amount to a contact with a confirmed case of an infection in the context of COVID-19. Now, any person living in the same household or with direct physical contact, this could, of course, also mean office spaces that are shared. This will be described as a contact. A person who has been in a closed environment or has had a face-to-face interaction, even at a distance of a meter, is said to be at risk. And also, the other commonly asked question is, what should a person who's been quarantined at home do? The person should, in fact, stay in a well-ventilated single room, preferably with an attached bathroom. The person should also wear a surgical mask at all times and stay away from elderly people as much as possible. And the other who should also avoid coming in contact with these individuals who may be suspected of having COVID-19 are pregnant women, children and others. And these individuals who are suspected to have contracted the coronavirus infection should restrict their movement as much as possible, even within the house. The person under no circumstances should attend any kind of a social or a religious gathering if he or she is exhibiting symptoms. And also, the person should immediately inform the nearest health centre or call the helpline numbers that have been issued in the respective city and state. And also, this of course is a question which a lot of people have asked. What should family members of the quarantined individual do? Now, only an assigned family member should be tasked with taking care of the quarantined individual and meeting his or her needs, and visitors must not be allowed under any circumstance. There should be no direct contact with the quarantined individual. In case the quarantined person becomes symptomatic, then all their close contacts will also need to be quarantined in their homes. Now, the question that people still ask is, how should they clean the quarantined room? Now, clean and disinfect frequently touched surfaces in the room daily with about 1% sodium hypochlorite solution. All clothes and linen used by the person should be cleaned separately. Now, we request all our viewers to exercise caution and report any such suspected case by calling on the government helpline numbers which are presently on your screens right now.